Hey, what's up guys? So let's talk about a topic that I'm pretty passionate about, and that is whether or not compounded testosterone cream can be useful and beneficial, and something to at least consider if you are a man who has low testosterone. Most guys want to do an injection. I get it. I know. I have these conversations all the time, and in some ways I understand why. It's easy. It's been out for a long time, so we know it feels a little macho to give yourself a shot, so you feel good about that. And you obviously don't have to do it very often. You can do it 1 or 2 times a week. So from a compliance standpoint, it's helpful. There are some side effects or some issues that are potentially happening with injectables. One in particular has to do with your cholesterol levels. So injectable testosterone, for example, will lower what's called HDL, which is what we refer to as your receiving cholesterol, or a lot of people call it your good cholesterol. But it is what helps us to break down some of the lipids in our system, and we want HDL to be at a high level. Testosterone cream that is compounded actually shows benefit for HDL, so it improves HDL. So that's an example of why somebody may want to consider it. Another reason to consider testosterone cream would be because it is something that tries to match physiology. You don't use testosterone, or when you made testosterone physiologically, you did not produce it in 1 day or every 3 to 4 days. You had pulsatile secretions of testosterone in your system. With cream, you're doing it twice a day, which can be a little overwhelming or a little daunting for a guy to have to do something twice a day, but you're trying to match physiology as much as possible, and that can be very beneficial so that you get these ebbs and flows of testosterone on a daily basis. Another huge benefit is that with injectable testosterone, you can often see a slight elevation of blood pressure. With cream, you don't see that. And I know that there's a lot of data or controversy about using creams, and a lot of people get confused about when I say testosterone cream, what am I even talking about? A lot of people think when they hear cream that they're thinking of androgel and things like that, which has been out for a long time. Androgel is really not what I'm referring to. When I'm referring to testosterone cream, I'm talking about something that has a lipophilic base, so it's got like a fatty lotion to it, so it absorbs really well. Whereas androgel is an alcohol base, it does not absorb well. You rub it on your arm. There's a lot of problems with it. It doesn't really get the levels that we tend to want to see. Another benefit of cream with this lipophilic base is that you see an increased conversion of testosterone to DHT. DHT is very potent. DHT is a 5 to 7 times more potent form of testosterone than testosterone itself. And so if we can do things like using testosterone cream in a compounded form to increase our DHT to give us more motivation, more focus, more energy, more libido, greater lean muscle development, better recovery, that should be something that you should at least have a conversation with your provider about. Now, one of the things that I tell my patients all the time is that if you're 60% compliant with the use of the cream, it's probably 0% effective, right? So if you're not somebody who can do something twice a day, it's probably not something you need to consider because you're not going to see the benefits. Another area that can be problematic, or at least difficult for guys to wrap their mind around, is where do you put the cream? We tend to want our patients to apply the cream onto the scrotum. So we want to use it in an area where there is thin skin, which means high absorption rate. It also allows us to put it on in an area where we don't have to worry too much about transference. And so we're using it at times of the day where we can avoid skin-to-skin contact in that location, and we can get high levels of absorption. I hope this is helpful. If you've got any questions, please feel free to reach out to me, info@optimizehealthnow.com, or you can go to our website at optimizehealthnow.com.